Hello everyone, welcome to the Windstroke Seminar brought to you by Lamp AccuWellness Foundation as part of its continuing Lamp Lectures series. Our topics for today are treatment for patterns in the sequelae stage and other methods of treatment. After a windstroke attack, besides treating the symptoms, it is important to attend to underlying imbalances that caused the stroke in the first place. These imbalances are obviously still present and they predispose patient to further attacks. Wind-phlegm, clinical manifestations, contraction of the limbs, severe dizziness, giddiness, and stiffness. The tongue is stiff and deviated, pulse wiry to slippery. Treatment principle: resolve the phlegm and extinguish the wind. Points: do 20, do 16, gallbladder 20, using the reducing or even method, stomach 40, lung 7, ren 9, spleen 6, reducing or even method. Do 20, do 16, and GB 20 are used to extinguish the wind. Stomach 40, lung 7, ren 9, spleen 6 to resolve the phlegm. Do 20, Baihue, 100 meetings, located on the head, 5 tsun, directly above the midpoint of the anterior hairline, or at the midpoint of the line connecting the apices of the two auricles. Do 20 is the crossing point on the Du vessel with the 6 yang meridians. It is also the C of marrow point. Functions: raises the yang, treats prolapse, subdues the yang, clears the head, calms the shen, dispels interior wind. Needling, subcutaneous insertion, 0.5 to 0.8 tsun. Do 16, Feng Fu, wind palace. On the back of the neck, 1 tsun directly above the midpoint of the posterior hairline, directly below the external occipital protuberance, in the depression between the trapezius of both sides. Crossing point of the Du and Yang Wei vessels, window of the sky point, C of marrow point. Dispels the wind, calms the shen, clears the head, benefits the head and neck. Needling, perpendicular or oblique insertion downward, 0.5 to 1 tsun. Do not puncture deeply. Deeper is the medulla oblongata. Strict attention must be paid to the needle angle and depth. Gallbladder 20, Feng Qi, wind pool. On the nape, below the occiput, at the level of Du 16, in the depression between the upper portion of sternocleidomastoideus and trapezius. Crossing point of the gallbladder meridian and the Yang Wei vessel. Functions: dispels exterior and interior wind, clears the head, benefits the eyes, nose, and ears, subdues liver yang, activates the meridian, relieves pain. Gallbladder 20 is an important point to treat any wind cold or wind heat pattern. Oblique insertion, 0.8 to 1.2 tsun, towards the tip of the nose with the tip of the needle slightly downwards, or subcutaneous insertion through Du 16. Towards the middle in the deeper layer is the medulla oblongata. The angle and depth of the needle must be strictly controlled. Stomach 40, Feng Long, abundant bulge. On the anterior aspect of the lower leg, 8 tsun superior to the external malleolus, lateral to stomach 38, 2 finger breadths, the middle finger, from the anterior crest of the tibia. Loop connecting point of the stomach channel. Functions: transforms phlegm and dampness, stops cough and wheezing, calms the shen, and clears phlegm from the heart, activates the meridian, and stops the pain. Stomach 40 is known as the phlegm point. It helps resolve phlegm throughout the body. Loop connecting points of one meridian can communicate with 2 meridians. They treat diseases of the collaterals and can be used to treat chronic diseases, especially chronic diseases of the Zangfu organs. Clinically, loop connecting points are often combined with yuan source points in the treatment of diseases. Needling, perpendicular insertion, 1 to 1.5 tsun. Lung 7, Lie Che, broken sequence on the radial margin of the forearm, superior to the styloid process of the radius, 1.5 Tsun above the transverse crease of the wrist. Lung 7 is Lu connecting point of the lung meridian, master point of the Ren meridian coupled with kidney 6, command point of the head and neck. Releases the exterior, expels exterior wind, helps descend lung qi, benefits the head and neck area, benefits the bladder. Lung 7 is a main point for releasing the exterior of wind cold and wind heat. The respective yin and yang meridians are externally related by Lu connecting points. Needling, insert obliquely upwards 0.3 to 0.5 Tsun. Ren 9, Shi Feng, water separation. On the anterior median line of the upper abdomen, 1 Tsun above the umbilicus. Opens and regulates the water passages, treats edema. Needling, perpendicular insertion, 0.5 to 1 Tsun. Spleen 6, Sen Yin Jiao, 3 Yin intersection. On the medial aspect of the lower leg, 3 Tsun above the medial malleolus on the posterior border of the medial aspect of the tibia. Spleen 6 is crossing point of the spleen, kidney, and liver meridians. Strengthens the spleen and stomach, resolves dampness, harmonizes the liver, strengthens the kidneys, nourishes blood and yin, cools and invigorates the blood, benefits urination, calms the shen. Spleen 6 is one of the most commonly used points and one of the most versatile. Because the point crosses the spleen, kidney, and liver meridians, it can treat many conditions associated with all the 3 organs. It is an important point in the treatment of any digestive, gynecological, and emotional condition. Needling, perpendicular insertion, 1 to 1.5 Tsun. Do not needle during pregnancy. Dump phlegm, clinical manifestations, feeling of heaviness of the body and of oppression of the chest, profuse sputum, rattling sound in the throat, blurred vision, dizziness, obesity. Tongue is swollen with sticky coating, pulse, slippery. Treatment principle, tonify spleen, resolve dampness, and phlegm. The points, bladder 20, Ren 12, reinforcing method, stomach 40, lung 7, Ren 9, spleen 6, using even method. Bladder 20 and Ren 12 are used to tonify the spleen and resolve the phlegm. Stomach 40, lung 7, Ren 9, spleen 6, resolve the phlegm. Urinary bladder 20, Pishu, spleen shu. On the back, 1.5 Tsun, lateral to the lower border of the spinous process of the 11th thoracic vertebra. Back shu point of the spleen. Tonify spleen, stomach qi and yang, nourishes blood, resolves dampness, regulates spleen and stomach qi. Bladder 20 is an important point to use for any spleen patterns. Excellent point to tonify the spleen and stomach for chronic conditions. Back shu points are corresponding points on the back where the qi of the respective zangfu organ is infused. If the 5 zang organs are diseased, abnormal reactions appear on the back shu points. Back shu points have a direct therapeutic effect on the diseases of the 5 zang organs. Needling, oblique insertion, 0.5 to 0.8 Tsun. Ren 12 or conception vessel 12, Zong 1, middle epigastrium. Located on the anterior median line of the upper abdomen, 4 Tsun above the umbilicus. Front mu point of the stomach. Converging point of the Fu organs, crossing point of the Ren vessel and small intestine, Sanjiao, and stomach meridians. Functions: strengthens and harmonizes the spleen and stomach, resolves dampness, relieves pain. Front mu points can be used to treat diseases of the affected zangfu organ and those of yang meridians and collaterals. They treat diseases of 6 Fu organs and diseases of yang meridians. An adverse reaction when the front mu point is pressed can help make a diagnosis. Needling, perpendicular insertion, 1 to 1.5 Tsun. Stagnation of qi and blood. Clinical manifestations: hemiplegia, pains in the shoulder and hip. Tongue is purple, pulse firm, choppy, or wiry. Treatment principle: move the qi and invigorate the blood. Points: Ren 17, even method. Bladder 17, spleen 10, even method. Ren 17 moves the qi in order to invigorate the blood. Bladder 17 and spleen 10 invigorate the blood. Ren 17, Tanzong, chest center, located on the anterior median line of the chest at the level of the fourth intercostal space at the midpoint between the two nipples. Front mu point of the pericardium, converging point of the qi. Opens the chest, tonifies and regulates lung qi, subdues rebellious lung qi, benefits the breasts. Needling, subcutaneous insertion, 0.3 to 0.5 tsum. Bladder 17, Geshe, diaphragm shrew. On the back, 1.5 tsum lateral to the lower border of the spinous process of the 7th thoracic vertebra. Back shoe point of the diaphragm, converging point of blood. Invigorates the blood, cools the blood, nourishes the blood, stops bleeding, descends rebellious qi, harmonizes the diaphragm, calms the shen. Bladder 17 is a very important point to treat any blood-related conditions. Since it's the back shoe of the diaphragm, it is also an important point to treat conditions related to diaphragmatic problems such as hiccups and shortness of breath. Needling, oblique insertion, 0.5 to 0.8 tsum. Spleen 10, Suhai, sea of blood. When the knee is flexed on the middle aspect of the thigh, the point is 2 tsun above the medial-superior border of the patella, on the bulge of the middle portion of quadriceps femoris. Invigorates and moves the blood, cools the blood, benefits the skin, regulates menstruation. As the name implies, spleen 10 is the point for treating disorders relating to the blood. Blood stasis, heat in the blood. Needling, perpendicular insertion, 1 to 1.5 tsum. Yin deficiency with empty heat. Clinical manifestations. Feeling of heat in the afternoon and evening, dizziness, tinnitus, night sweating, 5-palm heat, feeling of heaviness of the upper part of the body and weakness of the lower part when walking. Tongue is red without coating, pulse, floating, empty. Treatment principle, nourish the yin and clear empty heat. Points, kidney 6, kidney 3, Ren 4, reinforcing method. Heart 6, gallbladder 20, reducing method. Kidney 6, kidney 3, Ren 4, nourish kidney yin. Heart 6, clears empty heat. Gallbladder 20, extinguishes wind. Kidney 6, Chao Hai, shining sea, located on the middle aspect of the foot in the depression below the tip of the medial malleolus. Master point of the yin chao vessel coupled with lung 7. Nourishes the kidneys, clears deficiency heat, regulates the yin chao vessel, benefits the throat, benefits the eyes, calms the shen. Kidney 6 is one of the best points to nourish kidney yin. Needling, perpendicular insertion, 0.3 to 0.5 tsum. Kidney 3, Taxi, great stream. On the middle aspect of the foot, posterior to the middle malleolus, in the depression between the tip of the middle malleolus and tendocalcaneus. Kidney 3 is Yuan source point of the kidney meridian, shoestring point of the kidney meridian. Tonifies the kidneys, yin and yang, strengthens the low back, relieves heel or ankle pain. Kidney 3 is important to use for any kidney deficiency pattern. Clinically, Yuan source points are of great significance in treating diseases of the internal organs. Yuan source points are the sites where the Yuan or primary qi of the Zangfu organs passes and stays. Puncturing the Yuan source point stimulates the vital energy of the regular meridians, regulates the functional activities of the internal organs, reinforces antipathogenic factors, and eliminates pathogenic factors. This method of treating diseases deals principally with the root causes. The Yuan source point from the affected meridian is often combined with the Lu connecting point of the internally externally related meridians in use. Shoestring points are where the qi starts to pour down the meridian. They are known to alleviate heaviness and pain in the joints. On yin meridians, shoestring points are identical to the actions of Yuan source points. Needling, perpendicular insertion, 0.5 to 1 tsum. Ren 4 or conception vessel 4, Guan Yuan, gate of origin, located on the anterior median line of the lower abdomen, 3 Chun below the umbilicus, front mu point of the small intestine, crossing point of the Ren vessel and the 3 yin meridians of the foot, spleen, liver, and kidney. Strengthens, nourishes the kidneys, qi, yin and yang. Nourishes essence, benefits original qi, calms the shen, benefits menstruation and the uterus. Ren 4 has the function to tonify as well as maintain health. Needling, perpendicular insertion, 1 to 2 Chun. Heart 6, Yin-si, yin cleft. On the palmar aspect of the forearm, the point is on the radial side of the tendon, muscle flexor carpi ulnaris, 0.5 Chun above the transverse crease of the wrist. Shi cleft point of the heart meridian. Calms the shen, clears deficiency heat, nourishes heart yin, stops night sweating. Heart 6 is a very good point for steaming bone disorders and night sweating. A Shi cleft point is the site where the qi of the meridian is deeply converged. Qi and blood are stored deeply at these particular points. If there appears abnormal reactions at Shi cleft points, it shows that the pathogens have entered the deeper parts of Zangfu organs. Thus, they are used for acute painful symptoms, inflammation, protracted diseases of its pertaining meridian and Zangfu organ. Also, Shi cleft points of the yin meridians have hemostatic functions. Needling, perpendicular insertion, 0.3 to 0.5 Chun. Empty heat derives from yin deficiency, and the two pathological conditions, yin deficiency and empty heat, are often considered as one. All modern Chinese books include empty heat clinical manifestations under the pattern of yin deficiency. For example, under the pattern of lung yin deficiency, they will have dry throat and dry cough, yin deficiency, and 5-palm heat, empty heat. This is not the case in practice because yin deficiency may last a long time without symptoms or signs of empty heat. Thus, yin deficiency and empty heat are two separate pathological conditions, even though the empty heat derives from the yin deficiency. Symptoms of yin deficiency vary according to organ involved, but they will include night sweating and symptoms and signs of dryness, such as dry throat, dry cough, dry lips, dry eyes, dry mouth, thirst with desire to drink in small sips, tongue without coating, and possibly with cracks. Symptoms and signs of empty heat will include a feeling of heat that is worse in the evening, 5-palm heat, feeling of heat of palms, chest and soles of the feet, malar flush, low-grade fever, a red tongue without coating, and possibly a rapid pulse. Tongue shows conditions of yin deficiency and empty heat clearly. Although empty heat derives from yin deficiency, it takes time for it to develop. Therefore, a patient may display all the signs of yin deficiency on the tongue for several years without developing empty heat, and the tongue shows this clearly by lacking a coating. This is yin deficiency, but being of a normal color, no empty heat. As yin deficiency continues over time, empty heat may develop, and this turns the tongue red. Therefore, empty heat on the tongue is manifested by a red body color together with the absence of coating. One often hears that in yin deficiency, the tongue is red, a statement that is tempting to make since in yang deficiency, the tongue is pale. This is not so. In yin deficiency, the tongue lacks a coating. In empty heat, the tongue lacks a coating and it is red. Tongue without coating indicates yin deficiency, firstly of the stomach. It may also indicate yin deficiency of kidneys, liver, or heart. Yin deficiency and empty heat are not formed in a short space of time. It takes years for them to develop. The only exception is yin deficiency and empty heat that may form during acute invasion of wind heat, with heat penetrating into the interior. The tongue clearly shows the present condition, the stage it is at, where it is developing from, and what it may lead to. The three stages of the formation of indeficiency based on the tongue are: number 1, rootless coating. This is the mildest form of indeficiency. Number 2, coating partially missing. Number 3, coating missing completely. Empty heat may develop at any of these stages, but it is more likely to develop at the third stage when the tongue has no coating and it is becoming red. Best results are obtained if treatment is given within 1 month of the wind stroke attack, and good results if within 3 months. It is difficult to treat wind stroke of more than 6 months duration, and even more difficult if more than a year has elapsed. It is always worth trying even if the wind stroke occurred more than a year previously. If the stroke occurred within the last 3 months, treatment should be given literally every day, including Sundays. If the stroke occurred more than 3 months previously, treatment may be given every other day. A break of 1 to 2 weeks is necessary after 1 to 2 months. As for prevention, elderly people with symptoms of indeficiency, phlegm, heat, and liver yang rising are more prone to be attacked by wind stroke. High blood pressure and obesity are also predisposing factors. If we refer to the 4 main pathological factors of wind stroke, wind, fire, stasis, and phlegm, it is easy to see that any elderly person who shows symptoms and signs of 4 or even 3 of these factors may be prone to wind stroke. The presence of these 4 factors can be observed particularly clearly on the tongue. Wind makes the tongue stiff, deviated, or moving, or a combination of these. Fire makes tongue red, empty heat makes it red without a coating, stasis of blood makes the tongue reddish-purple, phlegm makes the tongue swollen with a sticky coating. Thus, if an elderly person has a tongue that presents 3 or 4 of the aforementioned characteristics, he should be treated to prevent the occurrence of wind stroke. Action must be taken to extinguish wind, clear heat, nourish yin if there is yin deficiency, move blood, and resolve phlegm. Some particular prodromal signs are indicative of the possibility of wind stroke, including numbness of the first 3 fingers of one hand and slightly slurred speech. Other preventive measures can be deduced from analysis of etiological factors of wind stroke. An old or middle-aged person with some of the aforementioned symptoms and tongue signs should take immediate steps to avoid overwork, lose weight if overweight, take adequate rest, reduce sexual activity, and avoid eating greasy fried food and drinking alcohol. Emotionally, it is important to overcome anger, hatred, resentment, or repressed animosity that would stir up rising of liver yang. When the above symptoms and signs are present, direct moxibustion on gallbladder 39 and stomach 36 can also be used. Gallbladder 39, Shenzhong, suspended bell, located on the lateral aspect of the lower leg, 3 tun above the tip of the external malleolus, on the anterior border of the fibula. Converging point of the marrow, strengthens the sinews and bones, nourishes marrow, activates the meridian, dispels wind dampness, relieves neck pain, relieves pain. Needling, perpendicular insertion, 1 to 1.5 tsun. Stomach 36, Susan Lee, leg 3 miles. On the anterior aspect of the lower leg, 3 tsun below stomach 35, 1 finger breadth, the middle finger, from the anterior crest of the tibia. Stomach 36 is He-See point of the stomach meridian, command point of the abdomen, point of the sea of water and grain. Tonifies qi and blood, harmonizes and strengthens the spleen and stomach, strengthens the body and Wei Qi, raises yang, calms the Shen, activates the meridian, stops the pain. Stomach 36 is known as one of the most important points to tonify qi and blood and promote general wellness. Hisi points are where the qi of the meridian collects and goes deep into the body. Hisi points are known to treat rebellious qi and diarrhea. Needling, perpendicular insertion, 1 to 2 tsun. Other methods of treatment. Electrical acupuncture. Electrical stimulation may be used on the limbs to treat hemiplegia. A dense to sparse current is used with low frequency connecting 2 points on the same limb. The intensity of the current is gradually increased each time the patient's sensation diminishes. If electrical stimulation is used, fewer points need to be selected. For example, on the arm, Li10 and Li4. On the leg, gallbladder 30 and gallbladder 34. The electrical stimulation should be maintained for 20 minutes every other day. The longer the duration, the stronger the intensity of the current should be. Li10, Shaosan Li. Arm 3 miles. Location. With the elbow flexed, Li10 is on the dorsal radial side of the forearm, on the line connecting Li5 and Li11 to tsun below the transverse cubital crease. Regulates qi and blood, tonifies qi, activates the meridian, stops pain. Needling, perpendicular insertion, 0.8 to 1.2 tsun. Li4, Heku, joining valley. On the dorsum of the hand, between the first and second metacarpal bones, in the middle of the second metacarpal bone on the radial side. Li4 is Yuan source point of the large intestine meridian, command point of the head and face. Expels wind and releases the exterior, tonifies qi and strengthens immunity, stops pain, regulates the face and head area, induces labor. Li4 is a very common and useful point. It is useful for any condition related to the face and head. It's also particularly useful for wind heat conditions like the flu. Li4 is known as the pain point in the body. Anywhere there is pain, use Li4. Needling, perpendicular insertion, 0.5 to 1 tsun. Do not needle during pregnancy. Gallbladder 30, Huantiao, jumping round. On the lateral side of the buttocks, when the patient is in the lateral recumbent position and the thigh is flexed, gallbladder 30 is at the junction of the lateral third and medial third of the line connecting the greater trochanter and the hiatus of the sacrum. Crossing point of the gallbladder and urinary bladder meridians. Activates the meridian and removes obstructions, benefits the hips and legs, resolves wind damp, relieves pain. Gallbladder 30 is a common and important point in the treatment of sciatica. Needling, perpendicular insertion, 2 to 3 tsun. Gallbladder 34, Yang Ling Chuan, Yang Heel Spring. On the lateral aspect of the lower leg, in the depression, anterior and inferior to the head of the fibula. Hisi point of the gallbladder meridian, converging point of sinews. Benefits the sinews and joints, activates the meridian, moves liver qi, harmonizes the shaoyang, relieves pain. Gallbladder 34 is a very good point to move liver qi and to treat anything related to the sinews. Needling, perpendicular insertion, 1 to 1.5 tsun. Scalp acupuncture gives good results if given within 1 month of the stroke. No body points are used when scalp acupuncture is used, and this may be alternated with normal body acupuncture. Scalp acupuncture consists of needling lines rather than points on the scalp, according to the brain's anatomy. In the case of hemiplegia, one would needle the motor line, its upper 1/5 for the leg, middle 2/5 for the arm, and the lower 2/5 for the face. This line is needled subcutaneously with one needle to cover the whole section of the line required, according to whether one is treating the arm or the leg. If inserting one needle subcutaneously for its whole length proves difficult, one can use up to 3 needles each for a shorter distance so that the whole section of that line is covered. The needle or needles are retained for 20 minutes, and mild electrical stimulation at low frequency may also be applied. Physiotherapy. This is absolutely essential to aid recovery in the sequelae stage of windstroke. Gentle exercise is also recommended, although it should never be carried out to the point of exhaustion. Thank you very much for your attention.